Hello everyone, my name is Dr. Viny Kantroo and I am a respiratory critical care and sleep medicine specialist at the Indraprastha Apollo Hospitals, New Delhi. I also look after tuberculosis patients, which is very prevalent in our country. So a lot of myths are still common in the society that once I catch TB, I will never be able to be cured of the disease. This is an incurable disease. There is no treatment available for tuberculosis, and once when I catch TB, it's going to eat up every system of mine. And not only this, there are a lot of myths around the medication which is there for tuberculosis. So many of the patients come in when they are put on tuberculosis medicines and they think that this medicine is extremely harmful for their body rather than the disease. So all these myths have no scientific basis at all. TB is curable by the chemotherapy which the patient receives in terms of anti-tubercular treatment, and it is completely curable. And if this is treated on time, the TB is not drug resistant, the TB is completely eliminated out of the body, and also once we treat the patients become non-infective in just a matter of 2 weeks. So it is absolutely essential that TB is diagnosed early, and also we treat the TB on time so that we do not pass on the tubercular disease to our next of kin, our relatives and our friends around. So we have many number of years of experience behind our back which supports the tubercular treatment, and also the fact that the tubercular treatment is very safe to be taken. We have treated innumerable number of patients with the anti-tubercular drugs. The side effects are minimal in about 95% of the cases. In only 5% of the patients we encounter certain side effects which are of the moderate category. However, these side effects are still manageable by a little tweak in the doses of the anti-tubercular medicine and also adding on certain additional medication. So it is very easy to treat tuberculosis if it is still drug sensitive. Once the TB becomes drug resistant, then it becomes a slightly uphill task, not only for the patient but for the caregivers as well as the doctor. So whoever communities believe that TB is not treatable, I will reiterate this fact that TB is completely curable. There is medication available not only for drug sensitive TB but also for drug resistant TB. The only matter of the fact is that if you have a cough which is lingering on for 2 weeks, you are producing excessive amount of phlegm, especially yellow thick phlegm, you have breathlessness, you have weight loss, you have a fever which is not going with any medication, you have already taken a course of antibiotics which is not getting your symptoms under control, you must visit a healthcare professional who can diagnose this condition very easily. Whether it is in your lungs, whether it is in your tummy, whether it is in any part or organ of the body, it is very easy to diagnose TB these days and treat it in a very nice manner. So drug-resistant TB is the TB wherein we are not able to use the first-line medication available for tuberculosis, which is the HRZNE, which means INH, rifampicin, ethambutol and pyrazinamide. These are the basic drugs which are used for sensitive TB. If any of these drugs is not acting on the tubercular bacilli, it becomes a drug-resistant TB. There are different categories of drug-resistant TB, and once these simple medications are not able to act on the tubercle bacilli, it becomes slightly difficult to treat tuberculosis. However, having said that, it is still curable, and we have second-line medications available wherein we can change these medications diagnose appropriately, and then see which of the medications are applicable and then give it to the patients. This kind of tuberculosis may need extra supervision in terms of liver function testing and the effect on other organs of the body, which your healthcare professional can easily do. There are certain drug-resistant tuberculosis, which are the MDR, which is multi-drug resistant tuberculosis, and on the other hand, there are the XDR tuberculosis. Both of these drug-resistant tuberculosis are now curable, and there are new medications available which can be given to the patient. And the best part is that these are available with the government institutions as well as the dispensaries. Even if a private healthcare professional is able to diagnose your condition and sends you to a government dispensary, you can get these drugs free of cost. Yes, absolutely free of cost. So that is the beauty of it. And our Government of India has initiated a campaign to make India TB free, which is a very good and welcome suggestion from the Government of India. And we all healthcare professionals are working towards it. But without the cooperation of the patient to come to the healthcare professional as soon as they have the symptomatology which is pointing towards tuberculosis, taking their medication on time, being compliant, not stopping their medication on their own, and getting a follow-up done from a healthcare professional or a pulmonologist is absolutely essential. So these are the things you have to look out in your society. If any of your neighbors, your relatives, anybody, your helpers in the house, they have the symptoms of tuberculosis, you should bring them to any institute, including the government dispensaries. There the testing can be done free of cost, as well as the treatment is available free of cost. The message to the caregivers and patients who are suffering from drug-resistant TB is don't fret or be afraid of the disease. This is completely curable. It's just a matter of time. You just need to put in some amount of patience and cooperation with your doctor.